want to say that this still very new Penny George Institute Foundation is very happy to be able to provide a $75,000 matching grant to help build the expansion that's going on. So I was told that you might be interested in kind of how I got to be here, because this is certainly not something that I had set out to do. I was a psychologist. I was very happy doing that, and my goal was to stay away from hospitals. I mean, I had no interest in changing them. But they say life is what happens when you're planning something else, which I'm sure some of you have already discovered. But it's because of my own personal experience healing from breast cancer that I saw what was needed. And it was just really clear to me that something had to be done, and that it wasn't rocket science. It wasn't like building a super robot computer. I mean, we could do this. All it took was will, and it turned out to be a lot harder than I thought, but it seemed easy at the time. But there's also a larger context to this, because I'm a child of the 50s, and I'm a lot older than almost everybody in here, but that was a different era in medicine, and most of you wouldn't know life before Medicaid and Medicare, and before healthcare was a term, and before Obamacare, big insurance companies and big healthcare systems. Medicine still existed in the context of relationships, and it was a kind of a covenant of sorts between particularly a physician and a patient. My dad, I grew up in a town very much like this, a town of 20,000 in rural Maryland, and my dad was a small town surgeon, and I can remember making calls on horseback with him to patients, and his being paid in hay and cakes, and you know, it was a different world. Prevention was the new polio shot. Wellness was not a social movement. No one ate processed food or much sugar, and everybody I knew was physically active and walked to school. The only magic bullets were those for serious infectious illness, and there was a pervasive sense of one's responsibility for one's own health, and to some degree to the health of one's community as well. So fast forward with me to 1996, 19 years ago last month. I come home from work on a cold February day to be greeted by a voice message on my answering machine telling me that it looks like I have breast cancer and that I should get a biopsy. So I go gather my mammogram and go schlepping over town, and it's finally confirmed that I do indeed have breast cancer. And so I decided to do, obviously, mastectomy and the chemotherapy and the hormone therapy. And my treatment, which was at the Virginia Piper Cancer Institute, was impeccable. I have no complaints about my care at all. But I did realize that I was only of interest in terms of the body part and the disease, and that there really wasn't anything looking at the whole of me. And I felt like that should be different, that I really was a whole human being, and I'd gotten myself in this predicament somehow, and there were things that I might be able to do to help myself get well and stay well. And I was also wondering why nobody pays attention, or nobody paid attention to how I might have prevented it. There were a lot of cancerous apples on my family tree, and as I began looking into it, I realized we really did know some things about how one might do that, but there wasn't any attention being paid to that. So I was determined to improve my odds of having this not come back, and so I made up my own healing plan. I sought out acupuncture to help me deal with hot flashes, massage and yoga to address the needs of my body. I read a lot about nutritional approaches to healing and dramatically improved my diet. I used guided imagery CDs to try to visualize a long and healthy life. But it wasn't the individual therapies that was so transformative for me. As important as they were, it wasn't that. It was the fact that I was in charge of my own healing, that I actually was listening to my own body and partnering with the best of medicine, but I was kind of in charge. And that was so transformative that I thought, we can do this. And as a psychologist, I knew how to read the literature to figure out what was legitimate and what was not probably such a good idea. And I also knew that I was privileged enough to be able to pay for these therapies out of pocket. And I knew that a lot of people couldn't do that. And yet I felt like everybody ought to have the option of having that whole person care that saw them as connected in body, mind, and spirit. And I wanted them also to see how much self-healing capacity each one of us has. So the first thing that my husband Bill and I did was to help design and then fund the position of healing coach at Abbott Northwestern Hospital, which is where I was treated and where he had been head of the board and where I was on the board. The position would help people create their own healing path like I had. And we funded that position for several years, and then the hospital kept its commitment to continue funding that. Through our family foundation, Bill and I worked with the Hospitals Foundation and then successive presidents of the hospital to help grow this idea of integrative medicine, starting at the nursing level, and then gradually building support among physicians and helping nurses obtain the training to provide therapies at the bedside. With the late Roberta Mann Benson's foundation, we formally created the Institute for Health and Healing in 2003 and built the first outpatient center. A couple of years later, Bill and I helped fund the expansion of that. Over time, as was noted, the Institute became the largest one in the country that was the system-wide. Today it has a presence at Abbott, Unity Hospital, St. Francis, West Health, New Ulm, and now we're so happy to have Owatonna be part of that. In addition to integrative medicine physicians and nurses, the Institute offers the services of nutritionists, mind-body therapists, acupuncturists, reflexologists, massage therapists, fitness experts, integrative psychologists, and others to offer individualized care for patients and the public. These professionals collaborate with each other and with the patient, and they operate as a team, bringing diverse perspectives and skill sets. As Allina's mission is to serve its communities by preventing illness, restoring health, and providing comfort, the fit with the Penny George Institute is clear. You are all part of that work now, and I commend this community for seeing the need and reaching out to make this happen. That's great leadership. And Courtney is the leader to help you fulfill the potential for the Institute here. She and Lindsay, who's back here, are stand ready to help you with that. And we will be excited to watch you grow. In closing, I feel passionately that if we as a society want to have better health, we need to focus on that. Yes, disease happens, and we will continue to improve disease care. But if optimum health and well-being are our goals, focusing primarily on disease is not going to get us there. Wouldn't it be wonderful if we could create a culture of health within a healthcare system? Across the history of this country, philanthropy has been the passing gear of society. It's the engine of social change. Our Family Foundation is one player in the movement toward integrative health and healing, and I hope you will join in spreading the word and expanding the services available to your community. You can be a significant accelerator of the change that needs to happen across the country. The reality of healthcare reform, or as I like to think of it, health reform, is underway. We have the challenge, the opportunity, and also the responsibility to create the most effective care models we know how to create, and to help individuals do their part to be full partners with the care teams that will support them. I feel privileged to be part of this national movement toward health, to be able to work with Courtney and her splendid team, and now with each of you to create a sustainable health care for the 21st century. Thank you very much for having me.